All right, so the next thing we're going to talk about is seizures. First of all, we need to know what patients are at risk for seizures. Patients who have a history of seizure disorder, any patient who has an infection in the central nervous system, any patient who has any other injury or illness affecting the central nervous system. But also think about your patient who is withdrawing from opioids or benzos or alcohol. Those patients are at risk for seizure. Think about your patient with a low sodium level. So if a patient is at risk for seizure, what do we do? We want to have the bed rails padded to help decrease the risk of injury. We want to have oxygen, an oral airway, and suction all at the bedside. We want the call light in reach. Sometimes people who have seizures are aware that a seizure is coming and they might be able to call us to give us a warning. Sometimes a family member will note a seizure and we want to make sure that they know how to call us to tell us. And then that patient needs to have IV access as long as they are in the facility and have in an acute care facility and have a seizure risk. So if a seizure occurs, what do you do? Never, ever, ever try to put anything in their mouth. Okay, no tongue blades, no padded tongue blades, no spoons. Don't put anything in their mouth. You're going to cause more injury. Definitely don't put your finger in their mouth with or without a glove, because the contractions of that seizure will cause them, they'll cause pretty severe damage to your finger. Never try to restrain someone who's having a seizure. You can get injured and you can cause more injury to that patient. So we know what not to do. Now, what do we do? You want to stay with that client and call for help. If you're able to suction, especially outside their teeth, get some of the secretions out of the way if you can, to try to protect their airway. But if it's possible, try to turn that patient to their side so that secretions will, if they're pooling in the mouth and can't get out, they're pooling on the dependents in the dependent cheek and not in the airway. You want to prevent injury by cushioning their head or removing possible hazards. If they have any anti-seizure meds ordered, PRN, because people with a history of seizures or with seizure risk might have a PRN order for a seizure med. So if they have that order, you want to administer it. You want to note the duration and the progress of the seizure, and you want someone contacting the provider if this is a new seizure or if the seizure doesn't respond pretty quickly to the ordered meds. Okay. After the seizure, you're going to very quickly assess airway, breathing, and circulation, provide emergency care as needed, assess the level of consciousness. It's very common for patients to be confused after a seizure. It's called post-ictal phase. They may be confused, sleepy, drowsy, and not really know what's going on. They may be anxious. So we want to reassure them and explain what happened. And then we want to provide hygiene and comfort, because it's very common for patients who've had a seizure or who are having a seizure to be incontinent. They may have vomited, there may be saliva. So we want to make sure that we provide hygiene and comfort. So that's safety or emergency care for seizures.